Hello, good evening, everybody. Welcome to Midweek's Mental Health. Hi. Today we are here to talk about exam stress because recently I put up a poll of what are the topics that you want me to cover, and a lot of people, I think mostly medical students, asked me to talk about exam stress as in handling it or how to cope with it. So I thought, because exams are also on the way for a lot of people, maybe I thought this will be quite helpful. Today we have Dr. Kriti with us. She and me will be discussing about what are the techniques to handle exam stress.
Hi,
Hi,
Dr. Charan.
hi.
Yeah,
How are you doing?
yeah, I'm good. What about you?
I'm doing okay. So
Okay,
I was just telling people why I chose this topic. Recently, I put up a poll on my page. Um,
okay.
70% of them asked me to talk about
Oh,
exam stress.
I can totally understand, like in this lockdown, what must be going through them. Totally clueless, like the
Yeah,
feeling like how we get, like when we take a break and prepare for our entrance, we don't know
yeah,
like how depth is the ocean.
yeah,
And
yeah,
you are studying, preparing, and to, like what is the extent, you are totally clueless. And this
yeah,
is must be happening to most of them. Like
yeah,
they're
yeah,
like we were tuned to it. Okay, this is
yeah.
how it's going to be after our medical, like we have to prepare for our entrance and all. But like now for like it is every student must are going through this
Yeah.
condition, so it
Yeah.
is yeah, quite a difficult
Because
phase.
Yeah, because there's sudden shift in the whole gravity, right? I mean, you can't go
Yeah,
to library, you can't go meet your friends in the
yeah,
house. Also, like, I mean, how many of us have like big houses? We have like average houses where a
exactly.
lot of people are making
In
noise.
house it's like even more difficult because no, like everyone are living in the under the same roof. People
Yeah,
have different outlook, and it is good for few, but like for most it is too much of overwhelming because everyone are like crossing the boundaries.
yeah.
You cannot set your own like roof of your own space. Yeah, I can understand. Finding a
Most of my
space for
patients are telling
yourself
me,
and studying.
yeah. Most
Yeah.
of my patients are telling me, or students, not patients exactly. Most of my students are telling me that why can't your parents like help you study? They are telling that when they tell their parents that don't disturb me, I'm studying. They're telling, what did you do the entire year? Why are you studying in the last minute? And blaming us now. Are we not supposed to work in the house because of you? Is what they're saying. Because lot of us study in the last minute. Uh, you
Yeah,
know, yeah. So that's a
like
big one.
exams are meant to be like, like a timetable is given so that like you just prepare few days before. But
Yeah,
for them, for few, like even parents might be like they are also working, they are also having their difficulties. Just they want to bring out that frustration. Probably sometimes they like word it in a wrong way.
yeah, yeah,
And it this pressurizes and makes
yeah.
students even more clueless.
Right. Kriti, before that, I want you to introduce yourself. Like, what do you do? Where are you working right now?
I'm a consultant psychiatrist in KMC Mangalore. KMC is Kasturba Medical College Hospitals. It comes under Manipal Hospitals. It's a corporate hospital, and like it is also attached to this KMC Medical College, a renowned medical college. So right now I'm consultant psychiatrist there. I'm working here from last 2 years. Before this, I was in different place in Kerala, also in Bangalore, everything. All
Right,
this.
right. I mean, everybody knows KMC. It doesn't need introduction.
Yeah. Okay,
All
nice.
right. So I have a few questions, Kriti. We'll just start with them.
Yeah, yeah.
So firstly, what are the general tips on the basic level? By the way, guys, it's not about medical exams. It's about every exam.
Yeah. Every
So
exam.
don't think, yeah, yeah.
In
Across
general,
all
like
age
all.
groups. Yeah,
Yeah. See, general things like what people like everyone knows, like if we have to like stay attentive. See the memory power or the cognitive attention, like what cognitive issues happens. Like mainly if we don't have good sleep, if you are not eating nutritious food, and if you're not physically active, and socially active. That's also important. Okay, and you have to like keep yourself up to date. Whatever is happened, like you have to make right from like you need to take breaks in between, but right from day one you need to keep yourself up to date with what you have to keep your focus on. Okay, this is the exam I'm cracking, so this is how I'm going to go about. Right from day one, like you have to have two nodes. In fact, like one is like general notes to like for your day-to-day rough work, and revision notes like where you note down important points, because like that will be a concise thing in the last moment. Those important things, those page numbers, reference notes, those things at least like it has to be kept in a separate notes. Like general tips in the sense like what I wanted to focus is your sleep, appetite, your physical activity, and social circle what you keep. So these things are very
All
important.
right, but unfortunately, all these four are exactly reversed in exams because people study last minute, so they don't sleep.
Yes.
They don't eat
Yeah.
nutritious food, especially if you're in hostel. You tend to eat whatever that comes to your hand.
Yeah.
Also, you eat on a lot of junk because you don't have to cook and it's easy.
Yeah.
And exercise, like, don't even ask about it because people even gain weight. It's very sedentary, that particular part of their life. Social
Yeah.
activity, and today's time, I really don't know because of pandemic.
Yeah.
But it's very important, like you're saying. So you're mentioning about all these three to be intact and to have a
Yeah.
study plan. Correct? Study plan
Study
is the
plan.
most
Yeah.
important thing.
Important. Yeah.
And fourth thing is concise notes. A lot of people, when you say concise notes, Kriti, what happens? Sorry, Kriti. What happens is that they take it from someone else, their friend. Usually, like
Yeah.
boys take it from
Hmm.
girls, and they tend to like take Xerox copies and they read, but they don't
Yeah.
understand because we all have different ways of how we put down the bullet points. So
Exactly.
prepare your own notes.
Yeah. This when you say this, like this reminds me. See, you need to know about yourself. Every person is different. Don't compare. Like that person is reading in this manner, so
Hmm.
that holds good for you. Even
Hmm.
this is a common mistake. Even parents do. Okay, they try to pressurize their kids. Right from the beginning saying see that kid is like waking up early in the morning and studying, or like
Hmm.
that kid is studying in this particular manner, so even you need to do this. So like we
Hmm.
are totally different compared to others. Some do try like to do artistic notes, color codings, some spider diagrams, and all. They try to they do it, and they are good at it in making. But some you would have seen their textbooks are totally untouched. Even not even a single mark on the book or underline won't be there. But that's the way they study. Okay,
Yeah.
they are good at it. Like they can just flap through the pages, they can grasp it, they can do it well. Even on the last day they can do that, flapping 200 pages, or like just before the day of exam they can crack the exam. And there are other set of people, like they can grasp things just if on discussion, like just by listening to what their friend is talking on a topic, or when two people are like reading aloud, they can just by listening to them, they can grasp things, and they can do well, they can understand, bring out concepts well. So different people have different methods of studying, so don't compare yourself, don't inculcate what other like what works best for your friends. See, there are a lot of like errors, and you commit like commit mistakes, but like learn from your mistakes. Don't try to do again and again which doesn't work
Same.
with you.
Yeah.
This is important for you to know. Hmm?
Yeah, it's very important to find out what works
Yeah.
for you because
What
especially
works
when
for
you
you? Yeah.
yeah, people usually imitate their best friends or a class
Yeah.
topper. Whatever they're
Yeah.
doing, if they tend to follow it, that doesn't work for everybody.
Exactly.
Like my
Yeah.
textbooks never had even 1 mark,
Yeah.
right?
See,
Yeah, but
that's
some people use like a lot of color pens and everything like that. But for
color
me,
pencil.
if there is color pencil on my paper, I can't study because I'm distracted. For
Yeah,
some people, they
I'm the
need
one who
color
like
paper.
I'm
Yeah.
the like third category. Like I used to like listen to people like discussing, and then I,
Yeah,
I
yeah.
used to got my own type of concepts. But this is how I used to study. Neither making notes there nor
Yeah.
the textbooks. Just here, like that. That's what like people like some things work for the like and time wasting time just because your friend is like making tedious notes, bringing out color pencils, diagrams, and all. Like doesn't work. Like
Yeah.
now the new thing is come. People get on this iPad making notes
Mm.
and all this notebook things. It might work for few, but might not work. Wasting time on that. On the at least for just before the exams, don't end up doing it.
I believe in trying to prepare very close to your actual exam pattern. Instead of using iPads, take down the pen, paper, and write
Okay.
down on that, because there is muscle memory also. There is,
Exactly.
yeah, like when you write down with pen, and sometimes that visual memory, that muscle memory can help in the exam than iPad or
Yeah.
whatever. So
Very
that is
true,
very
very
important.
true, very true.
Yeah, yeah,
Yeah, it has like a biological link also, like how your handwriting is connecting your like there is visual sketch pad in your brain and that is getting imprinted there. So
yeah.
like it is not something out of like we are trying to like put our own theory. It has a biological basis. That's
Yeah.
very true.
That is very true, guys, because when I make like a flow chart or something with like clear
Hmm.
handwriting in exam, when I forgot the concept, I used to feel like I'm copying from my own brain. Sometimes when I don't
Yeah.
understand the concept, at least the flow chart is to come in front of in my head, and I used to just keep writing it. So what
Yeah.
Dr. Kriti is saying is really correct. It's very important. Now
And
coming to
like
revision.
when you're studying, yeah, one more
Yeah,
thing, like came to my mind. When you're studying, like if you some things are like very difficult, you read it aloud in a different accent. Even this works. It is something like keeping some mnemonics and all, like reading it in different accents, and that suddenly like you happen to remember like reading aloud and like so that you remember like some different concepts or like the difficult formulas or the years which you need to recite in case of here like social science or history and all like they need to remember a lot of things or
yeah.
for civil service examination like so like recite like read aloud in different tone different voice that also like imprints and that you'll not forget, right?
True, true, true,
Yeah.
true. Because I used to have a teacher who has a very peculiar rhythm of the way she says. Some of what she
Yeah.
says used to come in my head in the exam. So you're
Yeah.
absolutely right. Right. One more important thing is obviously revision, because most of us, no matter how much we study, without revision, probably like we won't remember as much. What are the good? What are some of the good techniques you think for revision?
See revision when it comes like you have to have a like see if you're sitting for an exam like for a to crack a exam that might be a civil service exam or NEET exam or any important like or 10th board exam 12th board exam. So you have like make it in your mind like this is the time period I am going to start the revision. This is the date I'm going to start for revision. So you need to have that date. So till that revision date, you're just reading, okay, reading and making notes.
Hmm.
So set that date, okay. That from that date, there is no point of like no, you're not going to read anything new. Okay,
Yeah,
there might be little things like you need to fresh, like refresh and like get concepts here and there, connecting concepts. But the day of revision, which you have set just before the exams, make sure you're no reading anything new, okay,
yeah,
going back or if you have not completed any chapter you have left it out, just leave it there. Probably they are not they are less important chapters, that's why you did not cover it up, it's okay. And hardly like just like generally speaking in a 100-mark question paper or a 300-mark entrance exam questions, you need to concentrate focus on the more like chunk like the bigger chunk,
yeah, yeah,
so
yeah.
cover those topics and the smaller chunk, even if you're leaving it, it's okay. So after that, once you reach that date, that revision date, that day onwards, like your timetable should be set. That day, just make a timetable and a realistic timetable because no one knows you better than you.
Yeah.
Okay, not even your close friend, not even your parents or your teachers, only you know your ability better than anyone else. So you make a timetable, a realistic timetable according to your capacity, and in the initial days take up easy topics, okay, so that like you finish it and you don't get that, and you finish it and you get that sense of okay accomplishment, and you may mark that tick mark, okay, I finished these topics. So then you take up, like in between, you take up difficult topics or like bigger like which are important topics. Then you cover those things. Take like you can make it alternatingly, like the easier topics and the difficult topics, or the like important topics. Both are very different, but like you need to understand, and then that's the how you like cover it. And when you're covering, make a timetable. This initially you take a continuous to half an hour of studying and then taking a break. Then you can increase your pace. Like in that half an hour, these are number of pages I'm covering. Like 50 pages in half an hour is what I'm going to cover in the, or like 50 questions MCQs is what I'm going to cover in the initial half an hour. Then you keep increasing your pace according to like because it's a revision, you would have some concepts you would be already good at it. So like you can increase like, and when the exam is nearing, see, one thing I tell you, don't get scared of anxiety. Anxiety is not something, if you're anxious about it, is there is a good anxiety also, because it increases your willpower, it increases your motivation, and it speeds up your energy, and it makes you feel that like where you're good at it, and which like which is at what topics you're not good at it, it alerts you,
Yeah.
like some of the warning signs it gives. So don't run away from your like that gut sensation when you're reading. That means like you are really weak at it. The probably these are the signs, like these anxiety symptoms when it comes. Like so, like mark those things. Like take it seriously. Mark those points and re-revise it. Those are your weak points. So like if you're anxious, take care of it. If it is overwhelming and like beyond, like it is making you compromising your like reading capacity, that's the time like you need to go like speak to a professional, take help. Not at the end of exam, just before the exam, running to the doctor, it won't help you. Just so then in your revision time, like make use those concise notes
Mm.
and all that diagram. If you want to make a, again, a day before the exam, whatever you want to make those other like improvise your concise notes. Then what else in this revision tips? Practice, discipline is must. Okay, one thing people forget is like they take things very easily. Okay,
Yeah.
if you're very serious about the exam, discipline is very very important, and that's the reason practice, practice and practice to achieve what you want. And have that goal in this 3 months, this is what, and after that like you need not go and redo it. Have that
Yeah.
fear that like if I like clear this exam with good like marks, I need not do this again. So
Yeah.
like you put your heart out, and like you, that revision period is very important, and like you need to plan it and do it.
Yeah. Yeah.
Anything else you want to add to this?
No, but I want to emphasize on what you said again. The technique that you said really works. It works for me because when you start with easy topics and try to tick it off, there is a sense of accomplishment that will calm
Yeah,
down your nerves a little bit. So that will make you want to tick off more things.
yeah.
But some people start off with a difficult topic. So if you have like one day before exam, half day just goes into one topic and 13 topics
Into
are
one
left.
topic.
That
Yeah,
builds up
yeah,
a lot of anxiety and they will end up doing nothing.
yeah,
So you are right, and don't keep the difficult ones towards the end also, because sometimes towards the end you won't have time. So try to, like you
yeah,
perfectly said, keep them in the middle,
yeah,
in a realistic way where you can finish. And the things that you can't finish, just let it be. Some people try to just like brush through things that will confuse the
mm,
topics that they already read. Don't do that. It's not worth it,
yeah,
because you just need 50% to pass. Even if you don't,
yeah,
obviously you're aiming for to be the best, but if you're not, it's still okay. Don't, that kind of
yeah.
anxiety is not worth it. Yeah. Yeah.
Yeah. One more
um,
point I want to add to this. One more point,
yeah.
Dr. Charan.
Yeah. Yeah.
See, one like important thing you need to understand is like you have to have that smart way of studying.
Yeah.
Remember, any exam, revise, like don't go to the exam hall without revising the past question papers. This is a must. This is, you can't go like means like you're really like taken it like without revising the question papers. There is no like a way you are actually prepared. At
Yeah.
least a year, that previous year question paper, at least you need to read it just to get an idea like which are the important topics, what can sometimes questions do appear from the previous question
Yeah.
papers, whether
Yeah.
it is like MCQ based or whether it is the mains.
Very much.
Previous year question papers are must. And what happens? 60 to 80% question paper, like questions repeat
Yeah,
from previous
yeah,
5 years.
yeah,
In
yeah,
MCQ based entrance exams,
yeah.
60 to 80%. Only 20-30% like max 40% will be the new set of questions.
Yeah.
So the probability of people cracking the new questions are like you, how you are new to that question, like everyone and appearing to that like entrance exam are new to that question. So the
Yeah.
probability like scoring in those like new set of questions are actually less. And if you fail to like not answer correctly those repeated questions, then you are a failure.
Mm.
Then don't you agree with me, Dr.
Yeah,
Charan?
yeah, yeah,
You
yeah,
can't go wrong with the repeated question, like questions
yeah,
which have repeated from the past question years, right?
yeah, yeah, yeah.
This is very
Also,
important.
yeah, also when you talk about smart way of studying, even sometimes it's not just about how you study, it's about how you present in the paper. Because someone
Yeah,
who studied more than you might be still getting less marks, whereas you who read only partially still made better marks because the way you
definitely.
present to the
Exactly.
point, present to the point, write down all the important points, highlight them, use a lot of flow charts or pictorial representations, etc. that you can. So the
Yeah.
person who is correcting should want to read your question rather than they thinking that you just written some junk and they just want to trash it into a trash can. That shouldn't be the
Mhm.
case. So it will be very smart. I mean, yeah, I understand all questions we won't know. At least start with the questions that you know. Some people have this obsession with numbers. They want to just start with the 1, 2, 3, 4 only.
One,
It
two,
doesn't
three,
have to
four.
be
No,
like
don't
that.
do that. Don't do
Yeah,
that. It's
yeah,
okay. Like in a question paper, we'll just have like essay questions and all, 100 marks question papers. We just have like 10 to 12 questions maximum.
mm, mm.
So in that, like even if you are like going in the order what you want, like examiners won't mind it.
Yeah,
Right.
true, true, true. What about what is the importance of reading environment, like study space, creating a study space or station? How important it is?
Yeah, see, the place again, how like about how I discussed about different types of learners. This environment also it differs from person to person. Some might like study well in their own room. They want like their own place, not like keeping things in that particular way, arranging like want everything like in the hands reach every. This is the
Yeah,
arrangement. Some people do really well in this library. Okay, and some people even can sit in a noisy environment, like watching TV or like sitting in a cafe shop, or even listening to loud musics, or like listening to movie in a backdrop. They can grasp things.
yeah,
So this is important, like from for the parents also. Okay, don't judge on like how your kid is studying.
right,
They will have their own way. If they are underperforming, then you comment on it. If they are
yeah,
actually performing average and above, don't bother about it. Because it is really, it pressurizes, like because everyone's style of studying is totally different,
mm,
isn't it?
mm. Right, right, right. That is true because I worked well with slightly noisy environment because when it is quiet, I used to end up thinking about something or other. On
Yeah.
my mind is just waver off somewhere. When in kind of in where there
Yeah.
is noise, I used to perform really better. But a lot of people just think, why am I always listening to music before exams? Am I overconfident?
Yeah.
I used to listen to
Oh,
some like foreign languages which I don't know. Like I never used to listen to English because I don't want the
oh,
lyrics to disturb me. If it's a foreign
disturb. Yeah,
language, it's
that's
just a noise.
uh,
Yeah,
but
yeah,
just want one noise there,
yeah.
which camouflages other outside distractions.
Distractions. That is true. That works. Now the most important thing we're talking about stress reduction in case of exams. If you have panic attacks, or if you have even moderate or severe amount of anxiety, how do you think? What are the
Yeah.
simple things
See,
that you can do?
people, yeah, as I mentioned earlier, there is good set of anxiety. Anxiety is sometimes good, but anxiety at sometimes can become pathological. Something like it, you can become totally nervous and there will be blackout.
Yeah.
like many would have seen, like if not experienced by self, you would have seen some of the classmates having panic attacks, not completely like leaving the exam hall and quitting it.
Yeah.
So such cases we see very commonly in medical colleges, and it is the same with other colleges or like others, this one also, education institutions also. But like if at all you are a person who become very panic, or like you are never like got a panic attack, on that day if at all you happen to have a panic attack, probably just after entering the exam hall, just by reading the questions, like few just initial questions, like you read and you get the two main essay, I don't know, then they become panicky. So the main symptoms of panicky is, you need to understand, you might become like the little dizziness you will have, feeling of increased heartbeat, unable to, feeling of choking sensation, dryness of mouth, not able to feel the surroundings. These are the like symptoms initially what you feel like. The moment you feel this, the moment you feel like your senses are like wavering, and you need to understand, okay, you're losing it, you might have a panic attack. So get back to senses, get back to your the place where you are, like try to like stay in the in that situation by like sensing your those like improvising your five senses, your vision, your the hearing, and the taste, what you're able, the smell, and touch sensation. You improvise it, like see something very far and try to stay in the situation, in that
Yeah.
like in that situation, try to like hear the farthest noise, or it is swallow by, like if at all you are having dryness of to develop dryness. So these are few things. If you are not in a situation like an exam hall and you become panicky, and like in a like just before the exam, like previous day of the exam, like you become panicky, in a place where you can become physically act, jump around, like just loosen up your muscles, massage it, and just jump, okay, in that place. So just
Yeah.
to make you feel okay, you are in that situation, not lost it, like you are in like you are well. And the next thing is, take help, like immediately in the exam hall, like ask someone water, and like takes a help, like they tell that like this thing is happening. So you need them, like keep them informed. And then about breathing, take slow breaths, and count it and hold it for few seconds, and then slowly release it. This is the best way of relaxation. This there are multiple types of relaxation techniques which we talk to our patient, teach them, but this is one thing like which is very successful and can be done it in any place, sitting in a like in a traveling, sitting in your examination hall, or like just being with your in a classroom. You can do this. Take deep breath, hold it, slowly take a deep breath, hold it for a count of like 3 4 or even 6, and then slowly release it. These are the few tips to cope up
Yeah.
with your if at all you happen to have a panic attack.
Yeah.
For some individuals, like if you happen to see your friend having a panic attack, how to deal with it. So then first thing is, like, don't pressurize them, don't keep on asking, don't pick on them,
Yeah.
or and say that, or like don't underplay their fear. Okay, don't
Yeah.
tell that like it's all in your mind, why you need to take it that seriously, or you're overthinking. These, they don't, just calm them. Okay, tell them I'm there with you, and tell them that if you need anything, ask them what they need. If you need anything, like I can get, like just reassure them, be with them. If you're not able good at reassuring, just be with them. Okay. And I have seen many people helping with this like paper bag technique they try to do, and they will try ask them to blow it into the bag. Yeah, it is good technique, it is a good technique, but it has some other the like on the side
That,
of all it also, medically it is not at times can get dangerous, because what is this paper bag technique? It is when you see someone hyperventilating, you ask them to take this paper bag, right? Why do you do that? It's because they are hyperventilating, so there is carbon dioxide washout is happening, and that's why you're they're losing, like once when there is carbon dioxide washout is happening, they will have this alkalinosis, pH level increases, so that is not good. So they will immediately might develop carpal spasm and all. So to
Yeah.
help them, this technique is an age old technique which has been used
Yeah.
even now.
Yeah.
But when many a times what happens, some illnesses like a heart attack or even bronchial asthmatic attack, they have similar kind of symptom presentation like panic attack. So if you're doing it in a patient who is having risk
Yeah.
factor
Yeah.
of risk of these two, then it is dangerous. It is not
Mm.
very good, like you are giving a paper bag and rushing carbon dioxide to the patient. And the right technique of doing it is ask them to hold the bag, cover their nose and mouth completely, ask them to breathe 10 times into the bag, okay,
Mm.
and then take off the bag, then they have to breathe into the fresh air also.
Mm.
Huh?
Mm.
So this is the right way of doing it. But if it is like, if you're very confused, then just
Yeah, don't
chuck
do it.
it.
Better avoid
Yeah,
it.
don't do it. But it is the commonest thing what have heard people they're coming and telling that like I did that. But
Mm.
don't do it. The best way of doing is balloon blowing technique. Okay,
Yeah.
this is nothing but like what I said. Take deep breath from your nostrils and hold it and blow it through your nose, through your mouth. Like
Yeah.
hold it and like this you do. This is the best technique. Okay,
Yeah.
it actually relieves the anxiety, and it even relieves the panic attacks. Okay,
Right.
help
Right.
your friend to do this,
Yeah. Yeah.
right?
Yeah. True. That works well. That works well. Also, I think talking about diet.
One second, I got a call,
Yeah.
and there's the volume. Okay,
Yeah. Talking about diet, a
I'm
lot of
out.
people. Yeah, you are audible. You are audible.
I'm
Talking about
audible, but yeah, I'm not. You're not audible. Yeah, what is that?
talking about diet, a lot of people eat junk food or
Yeah,
energy drinks, a lot of coffee, or some people even smoke. But I feel like all of this will give just an instant boost of energy, and then it drains you very quick.
it,
So instead of
yeah.
that, maybe eating like a salad or something light will make you concentrate better, is
Mm-hmm.
what I think with the diet. Also, if you're having anxiety, coffee is maybe not a good idea for you because caffeine is a stimulant, so it might
Yeah,
worsen
these
your
are stimulant. They
anxiety.
can have
Uh,
like further episodes of panic
Further
attack.
episodes,
Yeah.
but a lot of people drink coffee just to stay awake. So
Hmm.
don't do that, is what I think. And also, I see people keeping
That's
taking
mainly
naps.
because of they tend to have coffee with sugar,
Yeah,
not
yeah,
the so that
yeah,
is
not the
also
caffeine.
like we don't get the pure form of caffeine. So
Yeah,
that
true,
like
true.
they tend to gain weight. That's true.
Yeah, yeah. Instead of taking multiple naps all through the day, it's better they take like a good few hours of sleep together. So at least you're completing all the stages of the sleep together. So that will work better for a lot of people. Because taking naps, again getting up, unable to, not able to concentrate, feeling little groggy and sleepy, then you'll take twice the amount of time to read the same question. That's not going to do any good to you. Am I audible to you?
No, actually it is not. I
Okay.
got a phone call. Okay, and then this suddenly
Okay. Okay.
volume.
Anyways, we're coming very
Yeah, we
close to
can
the
move on to the second.
yeah,
Yeah,
yeah.
next. You were
Uh, uh,
asking me something?
yeah. No, I was just telling that a lot of people say that I don't remember. I'm having memory
Haha.
problems. But I feel more than memory, you should think if you're able to concentrate. For example, if you're not paying attention to what I'm saying, how will you remember it later? So maybe the problem is with attention.
Exactly.
Yeah.
Yeah. See, like about memory, like I'll tell you, people
Mm,
have this, like not just only students, they come
mm,
asking, like, am I dementing or like, am I having memory issues? My neurons are dying like that. But one thing you remember, only if you register, then only you will be able to recall it
recall.
later.
Yeah.
Okay.
Yeah.
When like something is happening and your mind is occupied with some other stuff, okay, you're thinking about something else or worrying about something else, and someone has told you, or like they have told in the class, or like, and you've not registered it. If you
Yeah.
have not registered it, then you will not be able to recall it later, and remembering it later on after some time is again difficult. So memory issues is not always doesn't mean that your like brain tissue is regressing or dying. Don't directly like relate to it. It is not, there might be some other secondary causes for this memory issues, right?
Yeah. So patients come to us for asking for memory boosting pills. What do you think about that?
Yeah, many patients, especially like students, they Google about this memory pills. Like they want to know, and they come across like all these nootropic medications, like amphetamines, then what modafinil drugs, and even cholinergic medications. So remember, these are the medicines which we use it on patients with some psychiatric illnesses, like whether it is attention deficit hyperactivity disorder, or dementia patients, or patients with some kind of like who are already on medication and they are not having they are very little drowsy, not able to have that alert, that sleep wake cycle is like disturbed. In them we use such medications. In normal individuals these medications have no role. Like there is lot of studies which says like amphetamines work and all these people, this there is off labels drug over the counter medication supply also, but don't get addicted to it because there are a lot of adverse effects from these medications. These are prescription medications, especially like for some medical issue, psychiatric
Issues. Yeah.
condition, not for general public, not for healthy individuals. So
Yeah.
after some time, like just before the exam, like just before the entrance exam, they just want, no, I'm not here. I don't want, I'm sleeping quite a lot. I don't want to oversleep. At least like make me sleep only 2 3 hours in a, doesn't work like that. So,
Yeah.
okay. So don't get into all these shortcuts. Don't, hard work is the only shortcut, right?
Yeah, true, true, true. I think before we wrap up, I wanted to say a few things. A lot of anxiety does come from poor time management, be it during preparation or while you're sitting in the exam. So manage your time efficiently. Don't be overconfident that, I will do this last minute because someone else have done. Not everybody has the same capacity. Understand that. And subjects like, medicine and all, you can't by heart any which ways. You have to understand the concept. But some things there is no concept. So try to make mnemonics for it. For example, if medical students are watching this, the medical, pharmacological classes of drugs, you can't understand them. They are different. So make a mnemonic. But again, don't make mnemonic for everything because some people make too many mnemonics that you need a mnemonic to understand. Remember this. So
Yeah, yeah,
don't make too many mnemonics because you don't have to list out all the 10 causes. If you're able to remember all the 7 or 5 causes, that's good enough. So concentrate
yeah.
on that.
You need
Concentrate
not
on that.
like if you're able to partially like reproduce
Yeah.
it partially,
Yeah.
that is good enough.
Yeah, that is good. And another thing, what I want to tell people is on the day of exam, in the morning, they don't take bath. They just brush, reading in the books and run. Don't do that. Taking bath, like warm shower, especially increases your blood circulation and, makes you, remember better. Because most of
Yeah,
us study, but most of us forget or blackout in the exam about a particular question. So take a
yeah,
take a nice warm shower. It just takes 2 minutes. After that,
yeah,
don't eat a heavy breakfast. I see two people. One are the ones who are eating heavy breakfast that your mom makes. Other ones are the ones who eats nothing and runs. Don't do that. Eat a light, healthy
yeah,
breakfast. Because if you eat too much of breakfast, all the blood circulation is going into your stomach to digest it. So your brain gets less blood supply. So you tend to feel a little drowsy or tend to not remember things better. So eating light works, but not eating also is good, not good because your glucose levels also fall down. Another very important thing to improve your memory, attention, or whatever is dehydration shouldn't be there because in India we
yeah.
only drink water when we eat food. Otherwise, you don't. Please, I especially men, I don't see boys carrying water bottles. They just walk and go. Girls usually
Mhm.
come a little more prepared than boys, and that I have seen. Please take like a chocolate or two if you're feeling hypoglycemic, like a candy, like a small candy, and take a full bottle of water. Sometimes your neurons need hydration, not food. So you need to hydrate your neurons to remember things better. That works. And parents play a big role. Please don't put unrealistic expectations on your children. If everybody tops, it's not possible that everyone can top the exam. There's only going to
Yeah.
be one person who is topping the exam.
Yeah.
It really doesn't matter. At the end
Yeah.
of the day, everybody will do well. Everybody will fare well. So it doesn't matter. At least on the day of exam, just specially tell them that it's okay. Give it
It's
your
okay.
best. If your best is not good enough, it's still okay. Nothing to worry.
Yeah.
And once you're done with your exam, please don't come and sit and think that, oh, that question, oh, I forgot, written something else. Assess yourself, like what has gone wrong, but don't dwell into it. Don't just sit and like waste your
Yeah, that
time into it.
post-exam, postmortem of the question paper, don't do it. Doesn't help. Just if you're finished with your exam, just walk out, like prepare well for the next exam. Just brushing up of like knowing that like what you have on the whole, like you have done well, that's enough. Don't sit outside the examination hall and dissect it and feel sorry and like feel nervous and that will spoil your preparation for the next day also.
Next exam also. But again, always remember that exams are not forever, guys. It's just going to be a small part of your life. I mean, back in the day, I felt like exams such a big deal. Now, seeing patients and doing important things in life, exams didn't even matter to me. So don't take it seriously. The exam result or the score is not going to decide how well you will do in your life.
Yeah. This
so
reminds me like one more point. See, there is like when they are planning to give an entrance exam and only few months are left. And they don't want to give the exam because they feel that their preparation is not enough. And they will tell, no, madam, like I don't want to give this exam. I will appear for the next exam. Then I'll be like, what is the harm in giving this exam? Like what max is going to happen? Like it's that minimum amount of examination fees you have to pay, but at least that will give you that edge of like, okay, how much, what that, the like sitting in that examination hall, reading through that question paper, how it feels, that will give you that live experience of like how the exam is going to be. Even if you have not prepared it for the examination, don't skip the exams. Maximum what is going to happen, life is not going to end, like the world is not going to come to an end. You will not clear the exam, you will not pass the exam, you will not get good marks, that's all. So don't skip any exam, even if you're focusing on something very particular, like civil exams. The number of attempts matter, but and your age, everything matters. But if you're very sure in the next exam you want to clear it, there's no harm giving this exam. That gives you like that seriousness to this. So don't skip any exam, even if it is a board exam. People have this habit of preparing only for the 3 paper out of 6. Don't do that. You just go and attempt whatever it is. If you're finding it very difficult, take help of a professional in doing it. Don't skip exam. This is one thing which I tell all my patients who are who come to me with these difficulties. Many are with this mindset that like if they're not prepared, they don't want to give the exam. Who is going to assess your marks? It's just only you. Don't skip the exams.
Yeah, true.
Right.
Also, one more thing that worked for me was rewards. I used to watch like a lot of series like on cloud, maybe like Friends or Two Broke Girls or different series, which is like 15-minute series or something like that. So I used to be like, I'm gonna finish like a CVS or one chapter or whatever is in your capacity. So I'm gonna treat myself with one episode, which is just 15-minute long. But I'm gonna come back after 15 minutes. I'm not gonna just get carried away and do 2 episodes or 3 episodes and then panic.
So when you're doing that, you can even at least keep an alarm, like 15 minutes, keep an alarm and go watch it and come back. That's so that you know that like your time is up and you have to get back to studies. Yeah.
But if you're a person who thinks that plot of the thing that you're watching is gonna keep playing in your head, it's gonna affect your preparation, don't go for it. I'm telling you,
works. There is various way of taking a break. Just going and sitting and chatting with your family members, or like taking a stroll, or like watching something, listening to music. There is not a lot, playing a game, like anything, like will be a stress buster. Like just find your way. That's all.
Yeah, best is stretching and talking to somebody that comforts you. But again, don't talk to too many people thinking that what do you think will come in tomorrow's paper. They will tell that chapter, someone else will tell another chapter.
Yeah.
that itself creates a lot of chaos in your head, because nobody can predict it. There's nothing called important or not important. Sometimes it's just your fate also. You never know. You prepare what you think is important and just let it be. So that is very, very important. And before all of this, understand that it's not going to be end of your life. It's just one
Yeah.
exam. Especially, I think people who are giving NEET exam, they treat it like, okay, I had just done MBBS. Understand, you're done MBBS. That's not less.
Yes.
That's a big course. You
Yeah.
really swam a big ocean, and you have a varied knowledge. Understand that specialists, we have narrow knowledge on one subject. You people have knowledge about multiple things. Take it in your stride and just move on. There are different opportunities. It's okay to take risks, and go ahead and take something that for example, let's just say you want cardiology. If you're not getting it after 2 attempts, right? Think what else you like. Don't be so stubborn that I'm just gonna give it. It's okay to be having goal, but if you're not able to reach it, don't become depressed about it that you're not getting it. Don't let that decide your self-worth, that I'm not fit enough to be a cardiologist. That's not the only doctor. There are different doctors.
Yeah.
There are different things that you can do. So think in that way and just move ahead. It's not the end of the world. So anything else you want to tell before you go, doctor?
Last but not the least, let's see, psychiatric conditions like anxiety disorder and depressive disorder are common even in young, like children and adolescent age group. In fact, it has its onset at this age. So one thing you need to understand what differentiates a common exam stress or academic stress from the actual mental health issue is you need to understand, because many a times people don't tell you. You are new to it, you don't understand what is happening with you, and your parents will tell like you're just lazy and will blame you, or people who are around you, they will just they will not be able to, they will be like commenting on something else. So understand some, like if at all like your thoughts, this negative set of thoughts are not only related to exams or academic issues. It is again like widespread of around many other topics. Just like I'm not worth it, I have done a mistake, I shouldn't have spoken to my mother like this, or like so many years back, this is what I have done, that guilt feeling, then I'm not going to succeed in my life. These negative set of thoughts not restricted only to the academic issues, but it is also like spread to all other areas. At the same time, you are dull and you're anxious, not able to sleep, not able to have good food, like your appetite is low. In that case, it is not simply like your exam stress, it is something more.
Yeah.
That's the point. Like you need to alert yourself, you need to read a little bit about it, or you need to go and at least approach a professional and understand, like ask what is happening with me, and
Yeah.
tell your parents. If your parents are not able to understand it, go and discuss. If you have a counselor in your school, just go discuss with a counselor, or make an attempt of taking consultation on like there is online forums, you can consult the professional. So this is very important. Sometimes it gets neglected. People are their overall potential gets shrink, and they're not able to perform better just because of this unrecognized episodes, right?
Yeah. Yeah.
Then
True.
it will be very late. So
Mm.
like take care, like these are the important symptoms. If at all it's there, like take professional, and there is no harm in taking medications. Okay,
Yeah.
if the doctor feels
Absolutely.
that you require
Absolutely
medicines,
no harm.
absolutely no harm. There is lot of myths related to the psychiatric medications. Presently, what we use are newer generation molecules with least side effects. And first thing, the most important thing is you will not get addicted to these medications. These are
Yeah.
safe
Yeah.
to use.
Yeah.
Yeah.
Yeah, I think one last thing which I have written down is be very flexible with your timetable, because sometimes you might have to change your timetable. Don't feel like,
Yeah.
oh, it's gone for toss, it's gone for waste. Now what do I do? Don't get stuck there. Just move ahead. Also, don't worry about if you're not understanding the concept. If it's taking too much of time, ignore it and move on to the rest, and come back to it probably when you're feeling much fresher. It's the same thing in the examination also. If you're not able to recollect things about a question, don't just, I had that problem. If I'm not able to remember, I used to get stuck there and I used to keep remembering. I used to put such all my effort, all my cognition into it, and I used to feel so drained by the end of it. Then I learned that, I just have to just move on. I just have to leave some space and just go to the next question and come back to it if you have time or not. It's okay.
It's okay.
Yeah. That is very important. All right, I think that's our time. Thank you so much. I think it was wonderful. I learned about a couple of things, and I hope you learned a couple of things too.
So we had a good discussion. Hope it's quite a lengthy discussion we had. Did not realize. Hope this discussion really reaches out to people and it helps many.
True.
True. Okay, thank you, Dr. Charan, for giving me this opportunity.
No problem. Thank you so much. I'm very happy that you agreed. I'm going to save this. I'm going to share you the link so you can share it to more students or your patients who come to you for it. That might help for them. All right. Take care. You have a good night.
Thanks a lot. Bye.
Stay safe. Bye.
Take care. Bye. Good night.